Good morning, everyone. And I want to start by wishing you a very happy new year. It's nice to be in 2021. Even I think 21 will look a little bit different than 20.
Hold on a sec.
Okay, monitoring two devices here, and I forgot to turn the volume down on one. Anyway, thank you for joining us for our York County Community Sector Briefing. We are streaming this live on Facebook, and it will be available for viewing later as well. And as of now, I would like to introduce Laura McDougall with Four Corners Health Department and let her start with her update. Thank you, Laura.
Good morning, everyone. It's good to be here in a new year. It's also nice to be able to come and talk about vaccine this year. So I'm going to talk about two things this morning in my report. First of all, start off with, what we normally talk about with cases and trends. But then I also want to talk about what's happening with vaccine. So first of all, we'll talk about the cases and trends. We have really been seeing a trend now where things are sort of plateauing in terms of case numbers and hospitalizations. So in the last 7 days, we had about 145 total cases in our district. York County saw 49 of those. We are now at a cumulative total in our district of 4,338 as of last night. So, we had seen a peak in November where we were having over 400 cases a week. And now we're down to about, 145-ish. And we've seen this now for a few weeks. So we're kind of in a plateau situation. So we've seen our terrible peak. And with our plateau now that we've come down from that peak, in November into this plateau, which is still, though, really too many cases, more cases than what we'd like to see as we're starting schools back up and things. When we started school in the fall, we were at a very low level of community transmission. So just to kind of remind everybody, we still need to be doing those things like social distancing and wearing our masks and avoiding crowds and things, because we still have significant community transmission going on. But we are definitely in a much better place than we were in November. So that being said, it is important to continue working hard to, as a community, to slow down that transmission. We know everyone's indoors now for a while, for the most part, and that really is not going to help us when it comes to the spread of viruses. So please be vigilant. And looking then also in our current situation with testing and hospitalizations, I think we have a report from the hospital, so hopefully that covers that part. And we will listen to that, and if there's any questions, I can help answer some of that. So on to vaccine. Let's talk about vaccine. We have been receiving some vaccine for the past few weeks. In the past few weeks, we received about 1,300 doses of the Moderna vaccine into our district. And as we speak right now, we are having there's quite a few shots today was a big day for vaccine clinics and getting people vaccinated across our district. So we really expect by the end of the day, we'll have, over 1,000, if not 1,100 shots given. So the teams are using the last of this supply now to vaccinate healthcare workers and the priority groups that have been designated in the state plan that have happened across the state in phase 1A. So we have vaccine, we feel, to get through at this point, phase 1A. And we hope that we're going to be able to have that done by early next week. And I know that even in York today, the hospital's getting some of the stragglers rounded up, and we're getting shots, a lot of shots given. And to explain what's really how this rollout has happened, I know there's a lot of questions, and I'd like to explain locally what it looks like logistically and the picture that we're dealing with. We have had 7 providers designated within our district that have signed agreements to follow the state's plan of those prioritized groups. And the 7 partners locally are the 5 hospitals in our district, and then also the Four Corners Health Department and the Polk County Health Department. Excuse me. So in our county, in York County, we have the Henderson Healthcare System, York General, and Four Corners are the 3 designated vaccine providers. And that being said, we are not, that is who receives vaccine and are authorized to give the vaccines. And as we move forward, we're hoping that we can also pick up the York Medical Clinic to do some vaccinating, but that has not happened yet. They are waiting to be authorized. So we will be, but we're counting on the fact that they're going to be helping us in later tiers and be able to do that as well. So for right now, what has happened is this 1,300 doses have been shared among all of these 7 entities to try to address the priority groups in this phase 1A. And there's different tiers within phase 1A. So we've been working our way through healthcare workers, frontline healthcare workers, to physicians, to nurses and home healthcare workers, and people who are working with in the healthcare system. So, and then we're moving to make sure that we have people who have to do the vaccinated. And then also now we're starting to pick up dentists and some other groups as well. So as we get through this tier, it's going to use up these 1,300 doses and through this phase 1A. Our next phase that we will be doing then is the phase 1B. And within phase 1B, we have multiple tiers as well. The first group that we have to address is and get the vaccine to will be, once we finish up our phase 1A, will be the 75 years old and older group. We know that in our district, this is roughly 3,000 people. And so this is going to be quite a few people that we have to vaccinate. And we're getting a lot of calls at our health department, and I think our healthcare providers are as well. And we hope to start vaccinating them sometime after we get through our 1A early next week. And it will all depend on the supply of vaccine that we're getting. And we have been very limited looking forward into next week with the amount of vaccine we're getting, and almost to the point where we may not have any. So this will be next though. So if you are 75 and older, we will be looking to vaccinate you. We will be inviting you to come get a vaccine when we have the supply. We know that we're getting lists of patients who are 75 and older from their healthcare providers locally. But if you are worried or want to make sure that if you're really interested in getting a shot and you're in that group, there is a place on our website where people can let us know that they're interested. You can call Four Corners. So, and we will make sure we are working with all of these partners, and I really cannot say enough positive things about these partnerships with these 7 groups. We have been sharing vaccine with each other to make sure we're getting through our tiers and making sure that we're calling people in who we know might be interested in vaccines. And the teamwork and the dedication of this group is just amazing. So I just want to put a shout out to these groups we're working with, and what a wonderful job they're doing. And they really are very just so everyone knows how community-minded everyone is, and the fact that we are all working together, even at times sharing staff. It's really an amazing thing to watch in this pandemic. So know that you're being very well taken care of by your community hospitals. I'm so proud of the work they're doing and excited to work with them. So I think if anybody has questions, I'd be happy to try to answer them about the vaccine. Trying to make sure if I have missed anything. So within York County, it's the Henderson Hospital and the York General and Four Corners at the moment that are authorized to give vaccines. All right, so I think that for that, my update, I'm done for the moment and happy to answer any questions. Thanks, Lisa.
Laura, there's a couple of questions. There's a question and a comment for you.
Okay. Laura, are you holding back second doses for those who have been vaccinated in the 1A group? No, we're not. The state is actually, once we give all the vaccine that we've been given, we will receive our second doses. We've been promised that. So we are not holding back vaccine. It is our instructions to give everything that we get. So that's what we're doing. And then I have a question, or just Tom is writing in here. With our last update, we have given, as of last night, 957 vaccines. So we're probably over 1,000 already this morning, because I know York General is started early this morning giving more. So were there other questions that I'm not seeing in the chat? Okay, very good. All right, I think I'll just wait and see if any other questions come in then. Thanks.
Thank you, Laura. And I do have updates from both hospitals. Lisa with Henderson Healthcare is on. She does not have a mic, but if you have any questions for Lisa, feel free to type them in and she'll be able to answer. Let me get her update here. Hold on just a second. Okay, she said from Henderson Healthcare to let people know that the COVID vaccinations are being offered to employees within a structure of prioritization levels. And then from Jim Ulrich from York General, as of January 6th, 506 COVID-19 patients are hospitalized in Nebraska. There have been between 538 and 503 in the hospital since Christmas Eve. Back in November of 2020, that number peaked at 987. He said it's very good to see the lower numbers for our area. And then according to the new DHHS COVID vaccination report, 108,188 have been distributed across the state, with 53,418 being administered. So just less than 50% have been given out. Since last Tuesday, 88 individuals were tested through their OP drive-through testing with 23 positive results. That's a 26.14% positivity rate at that testing site. York General tested 56 last week with 11 positives. So that was a 19.64 positivity rate. And yesterday they tested 43 individuals through Test Nebraska at the York site. Over the period of 12/29 to 1 January 04 in the ER, they saw 8 COVID positive patients discharged to home. 3 were admitted and 1 was transferred to Bryan West. On the patient floor, they saw 3 COVID positive patients admitted, 0 transferred, and 2 remaining inpatients as of Tuesday. Over the past week, they have given 9 infusions of, I'm going to butcher this, Laura.
Just call it BAM.
BAM?
It's the monoclonal antibody infusion.
Okay. And then 8 infusions of the Regeneron. These medical terms. They are also treating 2 COVID patients within the dialysis unit at York General. They plan to administer COVID vaccinations to those remaining in the phase 1A tiers this Thursday, which is where he is, from 7:30 a.m. to 1:30 p.m. They plan to finish up phase 1A by next Tuesday. And they are also beginning their planning for community mass vaccinations. More updates and details to come in the days ahead. Currently, York General has 6 employees that are off due to COVID-related reasons. 4 of those were positive, 2 were exposures awaiting the test results. This number has been trending downward for York General, which is good as well. Actually, he said trending way down. This week, we are continuing our yellow, so moderate level restrictions at the hospital, and also continuing conducting outpatient overnight surgeries and holding patients in outpatient surgery if necessary due to census. Hearthstone and Willowbrook expect to hold their second vaccine dose clinic on January 19th. So that would be the hospital's reports. If there's anyone else in the health sector on, feel free to jump in. I don't see any more questions. So we will move on to the education sector. Mitch, do you want to start?
Yeah, good morning, everybody. Don't know if I have a big update for you, but we're off and rolling. We started with kids back on Tuesday. And, you know, we have, like you were just saying from the hospital, our numbers are considerably lower than they have been, you know, the last few months, which is a great thing. I was just peeking at the numbers there as we track daily. And so, you know, quarantines across the district were below 20. And we're still, you know, we still have some positive cases that we know of. And as I look here, we have a total of 6, you know, that are isolated at this point in time. So, you know, we've experienced that before. We have a good plan, you know, for that, working with Four Corners, and there's been great communication there. So, you know, we're hopeful. We're also, you know, anxious with the vaccination to, you know, to hear from Four Corners and so on. Dr. Jillian Fickinger is going to do she emailed me over the weekend and volunteered to do a Q&A Zoom session with our staff. And so we've got that set up. And so I think that's a great thing here. It's going to be in a couple of weeks. Just because I think there's just, you know, there's just a lot of questions that are still out there. And I think she'll do a great job of clearing some things up and so on. So I think one of the biggest things that we're probably facing at this point in time is that, you know, there's been a new DHM put out for activities and so on. That's 50% capacity. And that has created some issues between schools because there are some schools that are, you know, going with the new DHM and going with the new regulations from the NSAA, and some are not. And so we're kind of fighting that on a weekly or even daily basis, where if we go to a certain place, they may have more restrictions than we do, which causes some confusion. But what we've elected to do is we're going to follow the DHM as we always have. We're going to go 50% capacity. And so that does give some opportunity for some non-household members to come watch a ball game or so on. And we're good with that. We'll have a check-in process as people come in to the gate. But you know, we're going to have restrictions. Of course, people are going to wear masks. We're going to try to spread people out, you know, as much as possible, and so on. You know, the biggest, probably the next phase of this too is people are anxious as numbers have dropped and the DHM has changed. People are really anxious to get back to normal. I've heard that phrase probably 1,000 times within the last 10 days, and you know, my answer to that school-wise is we're gonna go at this slowly, and we're not going to be real anxious to make any drastic changes to our plan, just because, you know, we want to make sure that our buildings are as safe as they can be for our students and staff. So, you know, a lot to come here in these in the next few weeks and so on, and so. You know, again, we'll keep communicating what our numbers are, and if we make any changes, we'll communicate to our families and community as soon as we can. Thank you.
Thank you very much, Mitch. I'm not seeing Brad or any of the other superintendents on. I do know your college has an update this morning, so Emily, Sam, Gail, whoever's there, now's your turn.
Yeah, Emily Lutz here. Just want to say that our students start back in classes on Monday. We're excited for everybody to be back, and that we pretty much same exact plan as when we started in the fall. Some of our guidelines have changed just a little bit, but that's still in accordance with the CDC and obviously our local health officials. As always, you can find all of our COVID information for just what we're doing on campus or even with athletics on the website. There's a banner right there on the top of york.edu, as well as the athletic website, ycpanthers.com. So if anyone has any questions, let us know, but we're excited to start classes back in person on Monday.
Thank you very much, Emily. We appreciate the update, and we're excited to have students back in the community. I don't believe we have an update from SAC this morning. So we'll go on to the local government sector. Randy did text me this morning. The county commissioners have their swearing in ceremony this morning, so he is not able to attend, but he has no COVID updates. He just said Happy New Year to everyone. Barry, I will turn it over to you. Oh, wait a second, Barry. Hold on. Brad, is that you? From
yes.
Okay, let's get your update real quick. Oh, I didn't see you on there. Sorry.
Mitch Bartholomew ditto. He covers it always very, very well, and we operate under the same parameters 99% of the time anyway. So our numbers are down as well. We have a handful of students not with us. Staff-wise, I think we have one. So we're looking pretty good. We haven't changed any protocols at all during the day as far as masking and disinfecting and lunch period times and bus riding and all of that has all stayed the same. We haven't messed with that. And I would echo that activities is probably the biggest headache as far as time. You know, I haven't had a chance to see Mitch much, but I know one of the conversations that we've had with other administrators is what the heck did we do with all of our time when we didn't have to mess with this? And I know Laura's probably the queen of that. You know, it's just amazing how much time you spend every time some little thing changes. So probably the biggest issue with the DHM and the NSAA with attendance and the confusion comes in is as some schools are taking it very literally, where before spacing between family groups and whatnot was 6 feet and mandatory and this and that. Well, governors said, well, that's suggested. And so the 50% rule may have been, let's call it with distancing 250 people in the gym. Now could be somewhere around 400 if you don't have to distance. So people are getting all confused about it. So we've done what York has done as well, and that is we've just kind of held the line. and we just keep doing what we've been doing and try to minimize confusion. So I don't think you'd talk to any superintendent in the state of Nebraska that would disagree with wanting to get back to normal as soon as possible, where we can just open the door and say, come on in. And, you know, your biggest worry was if the officials showed up and your ticket takers showed up and then the concession stand was open, and beyond that, everything just seemed to happen. So we're ready for that. And vaccinations, we've got probably, I would say around 3/4 of our staff that's interested right now. And so I'll try to get those numbers over to you through the service unit here today, Laura, and we will take it when we can get it. The comment, and I don't know health department wise, I'm sorry, I joined a little bit late, but the question always comes up too about people who have experienced COVID and whether or not they are going to be of a less priority for vaccinations in schools or health facilities, or when it comes time for businesses. I'm one of those people. I had COVID around Thanksgiving. I am more than willing to give up my spot if I'm okay to do that to someone in higher need than I, if the vaccination numbers are, the quantity is low or limited. But if they say, no problem, we'll vaccinate everybody at school when we get the chance, then I'm in. I'll be first in line. So what's your take on that, Laura?
Yeah, sure. Thanks for that question. We have seen that just kind of anecdotally with these first shots that have been given, that sometimes people who've just very recently had COVID, and especially if they had pretty strong symptoms when they had COVID, we've been seeing some side effects. So, you know, maybe they might not feel the greatest for the next couple of days with their shot because their immune system is just already revved up, and you know, they see that the vaccine and it revs up their immune system and just feel kind of crummy for possibly for a little bit. And then there are people who take the vaccine absolutely fine. So really the only thing that we say right now is it's up to the individual. We are definitely offering it to people who've had COVID in the last 3 months, but you know, it's probably, you know, really up to you if you want to wait maybe 3 months before you get it after you've had COVID. And the other part of that is, you know, we're not going to turn anybody away. The only thing, you know, there are a couple groups of people that we do not want to give the vaccine to. And one of them being, if you still have COVID symptoms, you just very recently had COVID, that would be something we would want you to wait a little while before you get it. And then the other thing is, if you've had some of these monoclonal antibody infusions, it takes 90 days before you can have the vaccine. So if you've had like the BAM or the Regeneron or the, you know, it would be 90 days. But other than that, you know, we really encourage everyone to get the vaccine, and it's up to the individual as to when they want to do it after they've had COVID.
That's helpful. Thank you. We've had that question, and I've had that question in my mind as well. So, you know, if there's a way to guarantee that my 72-year-old neighbor could get it before I needed it because of supplied restrictions, I'd be all for that. But I just wanted to bounce that off of you.
Lisa, Margaret Brink here.
Yes, Margaret.
I just want to quickly thank Mitch and Brad. I don't know you, but I like what I'm hearing from you. I'm the president of the Board of Health. We appreciate the cooperation that Laura has talked about with the educators from York County. That's a big kudo to you and to what you're doing in helping us mitigate or get rid of this virus, because we want kids and teachers to be safe, and that keeps families safe. So thank you so much to York College and to the schools for trying to keep our kids as safe and still keep the activities going and all the things that you do. But thank you, thank you, thank you. That's it.
Thank you, Margaret. Thank you, Brad. I apologize that I didn't catch you had come on. Barry, now it's your turn.
Good morning. Good morning. No, I don't have a lot to say. I guess tonight's our first council meeting of the new year, reasonably short agenda. We'll be having a new city council member, Tony North, sworn in tonight. With that, I guess I would mention the mask mandate, which expires next Friday. At this point, there is not a meeting planned of the Board of Health at this point. There is some discussion going on amongst some of the members and different things, but there hasn't been a meeting set. So I would just say that, you know, of course, we would continue to love to see where the numbers are at and what's going on, and really want to have everybody stick to the cause on this. So I think, you know, when you look at some of the other parts of the country, Nebraska is doing a great job and keeping some of these things going the right direction. Hopefully the vaccines will only help that more. So other city business real quick, we continue to have several job positions that we're looking to fill and have those advertisements out in many places. So that'll be a big part of the city's current focus and future over the next while, is trying to get some of those positions filled. So we'll keep working on that. And the job pool in Nebraska is a little tight, so it's not the easiest thing. So we have challenges to get the right people for York, but we're confident that we'll be able to get that done. So with that, I'll say have a good day to everyone, and thank you.
Thank you, Barry. We appreciate the update. I do see other communities on. If you want to provide an update, now would be the time. All right. Then we will move on to faith, community, and nonprofits. Is there anyone on that would like to provide an update? Okay, we'll move on to the business sector. My update's pretty brief. I do know that the SBA has announced the extension of the PPP program. So I highly encourage you to work with your banker. If you're a banker, reach out to your clients, then just figure out if you qualify and if it's the right fit for yourself. As more information is released from the State Department of Economic Development, I will pass that on as well. And I wanted to say that we do know that many of our businesses are continuing to struggle with talent. And we are continuing to do promotions for talent recruitment and talent retention. If you have jobs available, please reach out to Derek in our office or send me an email or call my cell phone, however it works, so we can talk about how to help promote those. And otherwise, it's January. What a great time to reboot, refresh, and reset. So as you analyze what went wrong, what went right in 2020, because there's been a lot of positives as well. And then kind of start over, just refresh, let it go, move forward, and let's get 21 off to a great start. I will turn it over to Madonna if she has any reports. And then if there's anyone else that wants to talk about business, we would welcome you.
Thank you, Lisa. Good morning, everyone. I do want to echo what Lisa said, starting 2021 off in a great fashion. I was very fortunate to have a planning session with our executive team here at the Chamber, and just left that session very energized and continuing to look for the good, and no matter what, you know, take that pause and just find that good thread, and that will get you through. Starting our year off great, we will be having our annual Chamber banquet on January 19th. We are very fortunate in the city of York to have large facilities to be able to execute a safe event. We've been working closely with our caterer. Our caterer this year is Carrie's, as well as the convention center staff. So it will feel very normal in a very comfortable, safe environment. A reminder, we did opt to cancel the 2021 Ag Expo, which was scheduled to start today. But we are moving forward with the Home and Garden Show, February 19th and 20th. And our team has been working very closely again with the convention center staff to be creative in setting that up so it's enjoyable for the community as well. I do wish everyone to have a fantastic weekend this weekend, and have a great day.
Thank you very much, Madonna. We appreciate it. Does anyone have any wrap-up questions? I don't see anything on Facebook. Anyone here while we have Laura to answer?
I might just do a quick follow-up or an addendum to the PPP. There's also, with the change, that if anybody got the EIDL grant, that those are also going to be forgivable. So if you already got your forgiveness for the PPP in the first round, they're working on ways to apply to get that sent back as well. And then there's another program, I don't remember the exact title, but I talked to your accountant or payroll processor on getting, I think it's up to 14,000 per employee and they extended that into this first and second quarter of this year as well on a tax refund that can be used on payroll that's not used for PPP. So if there's reasons you've got payroll that wasn't a part of the PPP program. I think January 15th is a big date coming up for that. So I talked to them to make sure that you can get that for backdated, I think, into last quarter, and to find more details on that information as well.
Thank you, Stephen. And if you find out that applies to nonprofits, including the 5, 6, and 4s, all of those, please let us know. Okay, I think we are done. As Madonna said, we wish you a fabulous weekend. We wish you a great 2021, and we will see you in 2 weeks. Thank you, everyone.